For too long, our people suffered in silence, selling land and dignity just to stay alive. That era is over in Burkina Faso. Health is no longer a privilege, it is a right. We are proving to the world that an African nation, led by its own sons, can care for its people without begging. We stand and we build these say for our people and for our future.
Imagine this. Your mother is dying. Your brother is in pain every single day. Your child can go to school because every franc you earn is spent keeping someone you love alive. And worse, the only way to save them is by selling the very roof over your head. But today, that painful reality is changing. Not in Europe, not in America, right here in Africa. Welcome to Afrique Vibe News, your trusted source for Africa's boldest breakthroughs. And in today's report, we bring you an unprecedented story from the heart of Burkina Faso. In a revolutionary move that has never been seen in the country's history, President Ibrahim Traoré has announced that kidney dialysis treatment will now be 100% free for all Burkinabe patients. Over 200,000 citizens living with kidney failure will no longer need to sell land, homes, or cattle just to stay alive. Yes, free dialysis in a country that once struggled to even afford basic medical equipment. This is a giant leap not just for Burkina Faso, but for Africa's healthcare future. How did this happen? Where is the funding coming from? And why is this the most life-changing policy in Burkina Faso's modern history? Stay tuned, because Afrique Vibe News is about to uncover it all. The vision, the struggle, the impact, and how this single decision is restoring dignity and hope to thousands of families across the nation. Let's dive in. Every year, thousands of Burkinabe are diagnosed with chronic kidney disease. For most, this diagnosis is a slow death sentence. Dialysis, the only life-sustaining treatment, costs an average of $70 per session. With most patients needing 3 sessions per week, that's over $800 a month in a country where the minimum wage is less than $60. Families are forced to sell livestock, farmlands, and homes. Some even migrate abroad in desperate search of income, leaving behind broken homes. Hospitals are overcrowded, understaffed, and under-equipped. Patients wait in long lines, hoping to be among the few who can be treated that day. In villages, many die quietly, untreated, unheard, and undocumented. This was the silent health war Burkina Faso has been until now. President Ibrahim Traoré didn't just announce a policy. He declared a revolution. On national TV, flanked by health officials and patient advocates, Traoré announced, "Healthcare is not a privilege for the rich. It is a right for every Burkinabe citizen. Starting today, dialysis is free for everyone who needs it. Not next year, not next month. Today." The announcement was met with shock and celebration. Families cried, doctors applauded, and patients, once hopeless, now had a reason to fight. So how did Burkina Faso pull this off? Emergency budget reallocation. The presidency slashed non-essential government spending, redirecting funds from luxury vehicle imports and elite travel to health infrastructure. International health partnerships. Through strategic negotiations, the government partnered with health-focused countries like Cuba and India, securing affordable dialysis machines and training programs. Diaspora investment bonds. Burkinabe abroad were given a chance to invest in their country's health system through special diaspora bonds, raising millions. Tech for health. The government launched a national health database to track and manage kidney patients, ensuring no one is left behind. Voluntary medical corps. Hundreds of health professionals volunteered for training to meet the growing demand in regional clinics. What looked impossible just a year ago is now happening, village by village, clinic by clinic. Before this reform, only 3 hospitals in Burkina Faso could perform dialysis. Today, over 20 dialysis centers have either opened or are under construction across the country. From Bobo Dioulasso to Fada and Gourma, rural patients are now receiving treatment in their home regions. This decentralization of healthcare is saving lives and reducing transportation costs for patients and families. In Kaya, a town once known for drought and displacement, a new dialysis center now stands as a symbol of renewal. Equipped with solar-powered backup systems and water purification labs, it's one of the most advanced in West Africa. The center is already treating over 300 patients, and the number is growing. Burkina Faso's bold initiative is igniting conversations across Africa. In Nigeria, where dialysis treatments remain a heavy burden on families, medical professionals are calling on the government to follow Traore's lead. Dr. Olufemi Ajayi of Lagos General Hospital told Afrique News, "This is the model. This is the future. If Burkina Faso can do this with limited resources, what are we waiting for in countries with far bigger budgets?" In Ghana, the health ministry has reportedly sent a delegation to Ouagadougou to study the structure of the new program. Meanwhile, in Kenya and Senegal, civil society groups have launched petitions demanding similar programs. Across Francophone and Anglophone Africa, one question keeps ringing. If Traore can do it, why can't our leaders? This initiative has become more than healthcare. It's a symbol of leadership with purpose. President Traore's government is not stopping at dialysis. Officials have revealed that this program is part of a larger 5-year plan to build a fully self-sufficient national health system. Here's what's next. A national pharmaceutical industry. Burkina Faso will begin producing its own essential drugs, reducing reliance on imported medicines. Medical Engineering School. A new university program has been announced to train biomedical engineers locally. Rural health access. Mobile clinics and telehealth programs will bring quality care to remote areas. Free health insurance for vulnerable groups. Pregnant women, the elderly, and disabled citizens will receive 100% state coverage. Health workers' revolution. Salary upgrades, housing allowances, and better training programs for nurses and doctors. What began with free dialysis is now evolving into a national movement of medical dignity. At the launch of the Kaya Dialysis Center, a woman named Adiza Nikima stepped up to the podium with her son. Her son, 11-year-old Mahamadi, was diagnosed with kidney failure just over a year ago. They had already sold their 2 goats and their family motorbike. The father had left home to seek work in Côte d'Ivoire, and Adiza was left begging neighbors to save her boy. Today, Mahamadi is alive, smiling, and attending school again. "I got my son back," Adiza said with tears in her eyes. "We used to live waiting for death. Now, we live planning for tomorrow." May God bless President Traore. This is not just one family's miracle. It's becoming a national narrative of survival. As with all bold programs, there are critics. Some economists warn that maintaining free dialysis could strain the national budget. Others fear that donor backlash may affect other sectors. But Traore's administration remains firm. Health Minister Dr. Yakuba Zongo stated, "There is no development without healthy people. If we must choose between luxury cars for ministers and dialysis machines for the poor, our choice is clear. We choose life." Experts agree that transparency, effective audits, and community monitoring will be crucial in keeping the system efficient. The people have embraced the program. Now, the world is watching whether this bold step can go the distance. In marketplaces, schools, mosques, and churches, the word is spreading. Free dialysis has become a symbol of Traore's vision. From a taxi driver in Ouagadougou, "I never cared for politics. But this one, he listens. He acts. That's a president." From a farmer in Gawa, "My wife was sick. We were ready to sell the farm. Now she's getting help. I cried when I heard." From a young university student in Bobo, Burkina Faso is writing history. This is how Africa wins. The support is not just emotional, it is transformational. President Traore's initiative challenges Africa to rethink health and human dignity. For decades, health systems in Africa have depended on international donors, NGOs, and imported solutions. But Burkina Faso is saying, we can lead ourselves. It's a call to action, not just for governments, but for private sectors, civil society, and the diaspora. It's proof that where there is political will, there is always a way. This is not the end. This is the beginning of a people-centered model of governance. Burkina Faso has spoken, and the world is listening. In a time when healthcare is a crisis across the globe, a small West African nation is setting the bar higher. Choosing life over profit, choosing action over excuses, choosing hope over helplessness. This is not charity. This is not aid. This is justice. From everyone here at Afrique News, we salute the courage of those fighting for their lives, the integrity of leaders who put people first, and the power of an African dream that is finally waking up. If this story inspired you, share it. Let the whole continent know. Africa is rising, and Burkina Faso is leading. Don't forget to like, share, and subscribe to Afrique News, where Africa tells her story, her way.